How are antipsychotics researched for bipolar disorder? Researching how antipsychotics work for bipolar disorder involves many steps to ensure they are safe and effective. Scientists start with carefully designed clinical trials, which are the gold standard for testing new treatments. These trials often involve randomly assigning patients to receive either the antipsychotic medication or a placebo, sometimes along with other mood stabilizers like lithium or valproate. The goal is to see how well the medication reduces symptoms during manic, depressive, or mixed episodes, and whether it helps prevent future episodes. Researchers look at various outcomes, such as how quickly symptoms improve, how often episodes recur, and what side effects patients experience. They also track how many people stop treatment due to adverse effects, which helps determine tolerability. In addition to clinical trials, scientists conduct systematic reviews and network meta-analyses. These studies combine data from multiple trials to compare different antipsychotics directly. For example, they might compare drugs like aripiprazole, quetiapine, or asenapine to see which ones are most effective at controlling mania or depression and which have fewer side effects. This helps clinicians make better choices tailored to each patient's needs. Long-term effectiveness and safety are also studied through observational cohort studies. These involve looking at real-world data from patient health records and prescription histories. Such studies can include diverse groups, like people experiencing their first episode or those in general medical settings. They help us understand how antipsychotics perform over months or years, including their impact on hospitalization rates and long-term health outcomes. For example, some research focuses on long-acting injectable forms of antipsychotics or drugs like clozapine, which may be used in treatment-resistant cases. Understanding how antipsychotics work in the brain is another key part of research. These medications primarily target dopamine receptors, especially the D2 receptors. During a manic episode, dopamine activity is often overactive, which can cause symptoms like heightened energy, impulsiveness, and euphoria. By blocking dopamine D2 receptors, antipsychotics help calm this overactivity, reducing manic symptoms. This neurobiological insight guides the development of new medications and helps explain why these drugs are effective. In summary, research on antipsychotics for bipolar disorder involves a mix of clinical trials, reviews, real-world studies, and neurobiological investigations. Each approach provides valuable information about how these drugs work, their benefits, and their risks. This comprehensive research process helps ensure that treatments are based on solid evidence, supporting clinicians in making informed decisions. If you or someone you know is considering medication, it's always best to consult with a healthcare professional who can tailor treatment to individual needs and monitor progress carefully.